Tuberculosis prevention and control tests. Um, Tuberculosis exposure occur when a susceptible person stuck with a needle previously used for an injection on a patient having TB. A susceptible person inhale Mycobacterium tuberculosis bacteria carried throughout the air in a small droplet nuclei. C. A susceptible person drink water infected with Mycobacterium tuberculosis bacteria. A. D. Susceptible person eat foods infected with Mycobacterium tuberculosis bacteria. Answer is A. Susceptible person inhale Mycobacterium tuberculosis bacteria carried throughout the air in a small droplet nuclei. Number 2. A person who have high risk of TB exposure and infection include those who have close contact with person who have active TB. B. High risk medically underserved people such as homeless person and migrant farm worker. C. Illicit drug user. And answer is all of the above. Number 3. TB should be suspected in any patient exhibiting the following symptoms. A. Productive persistent cough lasting 3 weeks or more, unexplained weight loss and fatigue. B. Chest pain unaccompanied by sweating, nausea, and anxiety. So, C is non-productive cough, weight gain, shortness of breath. D. A mild fever, poor appetite, and swollen lymph node. So the answer is A. Productive persistent cough lasting 3 weeks or more, unexplained weight loss. Number 4. If a patient has unresolved symptoms of TB or has culture that has not been negative before after 3 months of therapy, he or she should be evaluated for potential drug resistance. A. Misdiagnosis condition. C. Autoimmune reaction. D. Continued exposure to the TB bacillus. Answer is B. Potential drug resistant disease. Number 5. Majority of TB patients show a positive sputum culture. B. A low red blood cell count. C. A positive throat culture. D. A barrel-shaped chest. Number 12. No, the answer is A. A positive sputum culture. The following patient should be considered potential infectious for TB. A. Patient who are coughing. B. Patient who have positive acid fasting bacillus sputum smear. Patient who have just started therapy. D. All of the above. Number 7. The respiratory AFB acid fast bacilli isolation room should be a private room which A. An adjustable venting system. B. A positive pressure exhaust system. C. Air exhaust directly to outside. D. Direct visibility from the nursing station. Number 8. When entering an acid fast bacillus isolation room to care for a patient who may have TB, the healthcare workers need to know that A. He or she should don a mask designed for AFB protection or respirator. B. He or she should don surgical mask, gown, and gloves. C. The patient should be wearing respiratory protecting mask. D. No protective equipment is necessary since the diagnosis has not been made. The answer: she should don a mask designed for AFB protection or a respirator. So number 9, a TB patient is no longer considered infection if he or she has had consecutive negative sputum smear collected on 3 separate days. So a TB patient is no longer considered infectious if A. He or she has been on anti-tuberculin drugs therapy for 2 weeks. B. His or her skin test result become negative. C. He or she has had 3 consecutive negative sputum smear collected in 3 separate days. D. He or she has received the BCG vaccination. Number 10, a positive TB skin test indicate definitive evidence of active TB, evidence of exposure to TB, evidence of decreased immune state, or D, a positive response to anti-tuberculin medication. So answer is evidence of exposure to TB. So OSHA, bloodborne pathogen test. Which of the following is a potential route of entry into the body for bloodborne pathogen? A. A mucous membrane. B. Puncture wound. C. Open burn of the hands. D. All of the above. The answer is D. All of the above. So, number 2, which of the following statement is true? Safer medical device or alternative to PE equipment. Gloves should always be changed between patient and between procedure on the same patient. See if there is any change of contact with blood and body fluids. D. Wearing gloves make it unnecessary to wash your hands between patient. So the answer is B. Should always be changed between the patient and between procedure on the same patient. Number 3. Primary activities of healthcare worker that has been associated with needle stick injuries include drawing blood, B. disposing of needles, C. handling trash and contaminated needles, D. all of the above. D. all of the above. Number 4, a mask and eye goggles or eye shield should be worn in any situation in which splash or spray of the blood or body fluids may occur. C. At all times in an emergency room. D. When drawing blood. So, mask and eye goggles or eye shield should be worn. B. In any situation which splash or spray of blood or body fluids may occur. Number 5. Standard precaution means treating all blood and body fluids as harmless unless person is known to be infected, potentially be harmful in person is a member of high risk group, C. potentially harmful if patient has AIDS, or D. potentially harmful in everyone. Number 6, new OSHA standard mandate that safer medical device such as needless system or safer needless system needle device. A. Be used when appropriate in all healthcare facility. B. Be used if the cost of such device is within the healthcare facility's budget. C. Are required only in operating room and outpatient surgical center. D. Do not have to be introduced into healthcare facility immediately. Number 7. OSHA work practice requires the safe cleaning